Good afternoon, everybody. I'm Maria Royce. I'm Senior Vice President at WellSpan, and I want to thank you for joining us for this community webinar. From the highest levels of our organization, the WellSpan Board of Directors, WellSpan's President and CEO, Roxana Gapster, and our entire executive team, we want to provide continuous opportunities to remain in touch with you and maintain open lines of communication as we respond together as a community to the challenges of COVID-19. Our CEO, Roxana Gapster, initiated a series of individual conference calls a couple of weeks ago. This webinar series is a continuation of that conversation with regular topics of interest as you tune in. We really value each of you as community leaders. On this call are individuals from Franklin County, Adams County, York, Lancaster, and Lebanon, where WellSpan has its facilities and its organization. I know on this call are local legislators, community leaders, volunteers, donors, and friends. And we want to thank you for joining us today. In these webinars, we'll be sharing updates on a few topics, but we really want to leave time to answer questions that you might have. And many of you, thank you so much, submitted many questions when you registered. So we'll start out after we do some prepared topics with answering those. We'll begin with updates regarding WellSpan's response to COVID-19 from Dr. Tom McGann, our Chief Physician Executive. And then we'll hear from John Porter, our Chief Operating Officer, about our preparations to meet increased patient care needs. I will then cover community connections and ways we can all continue to work together. We'll follow up then with a live Q&A. So if you have additional questions that haven't been submitted, please use the Q&A function at the bottom. It's usually at the bottom of your screen. You can submit those at any time as our team is talking, and we'll do our best to respond to those, and know that any we don't respond to on the call, we will respond directly afterwards. So thank you so much for everything that you're doing during this just unprecedented time and for joining us today. Dr. McGann, let me turn it over to you.
Good afternoon. This is Dr. Tom McGann, Executive Vice President and Chief Physician Executive of WellSpan Health. First, let me say that I couldn't be more proud of our communities for how we're all pulling together to support one another across central Pennsylvania. This has been an exceptionally challenging time, but within WellSpan and out in the community, people are truly rising to the challenge. Today, I'll share with you a few updates on WellSpan's response to COVID-19. It's important to know that we continue to be in regular communication with the U.S. Centers for Disease Control, or the CDC, and the Pennsylvania Department of Health to ensure that we are following the most current guidelines. We're seeing good news nationally and locally that social distancing is helping to slow the spread of COVID-19 cases. However, we must continue to be vigilant as we prepare for this anticipated increase in positive patients in our communities and in our hospitals. We encourage anyone who believes they may need to be tested to first be screened from home, either by web or by phone. On wellspan.org, use our coronavirus assessment tool to determine if testing is necessary. More than 12,000 people have used the tool to date. We also offer a toll-free hotline. That phone number is 855-851-3641. It's important that anyone who needs testing first be assessed through the phone or the web, or by their primary care provider. If upon assessment testing is determined to be necessary, they'll be directed to one of our testing locations. We continue to operate a network of approximately a dozen open-air COVID-19 testing sites across the region, including at our hospital campuses and many community-based locations. It is our hope that data will reinforce the need for our entire community to remain vigilant through this public health crisis and to continue efforts to slow the spread of the disease. If going to the testing sites, a doctor's order is necessary for tests to be administered. It's important not to encourage those who are asymptomatic to show up at one of our testing sites for this reason. We've completed more than 12,000 tests for COVID-19 since mid-March. Of the 11,000 or so results we've seen, about 1,100 have been positive. That's about 9%. The overwhelming majority of those patients are recovering at home, and a small percentage are being treated in our hospitals. We are working to develop an online platform that will provide more data about our COVID-19 testing and patient care, and hope to launch that next week. The COVID-19 information dashboard will provide daily updates regarding testing and patient cases across the health system and within each of the counties we serve. It's also important to rely upon the Pennsylvania Department of Health for more detailed data as we share our results with them, and they are a trusted source for accurate information. Their website is health.pa.gov. Because not all patients require hospital care, we've redesigned 10 care locations across the region to exclusively treat the non-emergency needs of COVID-19 patients, while protecting patients at our other care facilities from potential exposure. We continue to take every precaution within our care teams. Team members are screened when arriving to work each day and required to wear the proper personal protective equipment. We also ask that our patients wear a face mask when visiting care sites to protect our care team members. Those who do not have a mask will be given one upon entry. As you can imagine, this has created a need for masks within our system. You will hear about how you may be able to help our efforts as part of the 100 million mask challenge later in this update. I also want to comment about employers who may typically require doctor's notes for absences due to illness. We recognize the importance of having proof of medical care and how important that is. But right now, we'd ask for your lenience in requiring this of your staff. Our teams are working very hard, and there's an increased demand for these notes. An update I'm proud to share is that this week we released our first COVID-19 patients from ICU and hospitals, and we're seeing these good news as treatment of this virus comes full circle. In the example of the patient who had been very sick and in our ICU, caregivers sent them off with hallway parades and standing ovations, which you may have seen on some of the local news or social media. We've also significantly increased our use of technology and telemedicine to help slow the spread by keeping people at home, rather than having them travel to one of our care locations for treatment. This includes our 24/7 WellSpan online urgent care service, as well as video visits, phone visits, and e-visits that are conducted by WellSpan providers across our medical practices, primary care and specialty. Today, more than 40% of our patient visits are occurring either online or on the phone. Remember, all COVID-19 related care is being provided at no cost to individuals needing care. We're also using online tools to meet healthcare needs in a different way. Through our My WellSpan online portal, patients schedule appointments, access their records, connect with their care teams, all from the convenience of their computer, smartphone, or tablet. For needs related to COVID-19, we are one of the first health systems in the United States to leverage a new online patient care tool through our electronic health record. This tool, called Care Companion, allows patients who have been tested for COVID-19 to communicate important information to our COVID-19 connected care team, all through a quick app-based questionnaire. For general information, we continue to update our website, wellspan.org/coronavirus. with resources for patients, medical professionals, employers, and community members. We also have had some great information and resources for behavioral health right now. We believe strongly in caring for the whole person. That includes their mental and emotional well-being. And we know that this pandemic is not just a physical health concern. It's causing significant stress and anxiety among our friends and our neighbors. We'll share more about these resources later in the webinar. Now I'm going to turn it over to John Porter, who will discuss our ongoing preparations for the expected rise in COVID-19 cases in our community and our hospitals. John?
Thank you, Tom. I'm John Porter, Executive Vice President and Chief Operating Officer for WellSpan Health. Our community has done a remarkable job over the past few weeks to pull together and ensure those who need care will have continued access to it. It's important to remember that we have not yet seen the worst of this pandemic. We've been monitoring the projections, and we believe we will see increases in the number of COVID-19 cases in our communities in the coming days and weeks. But be assured, we are preparing thoughtfully for what we believe is coming and the strain that it will place on our hospitals and our care teams. We want to share this information with you so you have a picture of how we are preparing. We're hopeful that gives you a sense of our heightened level of response so that you can continue to consider ways your organization or group will prepare for the increased spread. Our plan includes the following. First, WellSpan is expanding its critical care capacity by at least double in all the communities that we serve. Second, while we have adequate supplies and equipment currently, we are working to secure additional supplies from FEMA, state government, vendors, local businesses, and community partners. And third, we are tapping into the strength of our current and retired workforce, as well as our neighbors in the community, to reinforce the critical care teams at our hospital. To expand our critical care capacity, we are redeploying operating rooms and recovery bays for critical care areas. We're able to do this because we have already postponed all non-urgent procedures and surgeries across our health system. We are temporarily redesigning WellSpan Surgery and Rehab Hospital in York County for non-COVID acute patient care, allowing more capacity at WellSpan York Hospital for COVID-19 patient care. Through these efforts, we're planning to add an estimated 250 intensive care beds at all of our acute care hospitals across central Pennsylvania. Lastly, we're exploring collaborative efforts with many of you, government agencies, other healthcare providers, businesses and organizations to provide additional space for overflow clinical areas if needed. Regarding our medical supplies, we have implemented a multi-pronged approach to ensure our hospital care teams have the equipment and supplies they need for the anticipated increase in patients. With 8 hospitals and more than 200 care locations, we have the ability to coordinate efforts and quickly redeploy supplies where they are needed the most. As Maria will detail later, we are exploring innovative solutions to our medical supply needs in partnership with our communities. And we continue to work with our state and federal governments to help source PPE, ventilators, and other materials. The government leadership in this area will be essential if we see a sharp and fast increase in COVID-19 patients in our hospitals. We thank our elected officials who have been outstanding partners throughout this crisis. We also know that more clinical staff will be needed to treat the influx of patients. We have already begun to redeploy our physicians, nurse, and staff to the hospitals with the greatest needs. We're able to do this because we had intentionally reduced patient volumes in other service areas in anticipation of this need. We're reaching out to our non-clinical team members to understand where we may have pockets who have had previous medical experience to assist in providing care if needed. I hope this gives you a sense of the level of preparation that we're moving towards at WellSpan and that you take into heightened precautionary steps as well, particularly for our most vulnerable community members. Many of you have made significant changes in how you serve them. We want to know how we are preparing so we can act as a prepared and unified front across our communities. And with that, Maria, I'll turn it back to you.
Great. Thanks, John and Tom. Really just terrific updates and great leadership during these times. I can't tell you how much, you've heard it a number of times, how much we appreciate the community support. I wanted to especially call out our elected officials. For those of you on this call, who have been such great partners as we make unprecedented changes and decisions to effectively respond to COVID-19. We've also been incredibly grateful for the outpouring of support for so many areas of our community. Local restaurants who are donating food, coffee, and other treats to boost the spirits of our teams. That really goes a long way. And as both John and Tom have mentioned, our communities have been really helpful with supplies. Our region has long been home to collaborative innovation and commitment to our communities, and we see it so readily in this response. Our social services are coming together to protect the health and safety of our friends and neighbors, so just thank you for all of that. In the spirit of this unity and the acknowledgement that we're all in this together, I thought I just might highlight a couple examples. Local businesses have been donating supplies. We have donation sites open in all of our communities, and we've gotten many supplies and equipment donated. Local distilleries are working with our pharmacists to produce a steady supply of alcohol-based sanitizer products. And local suppliers are helping us replicate national innovations for our frontline workers, such as those plexiglass shields and boxes to act as another layer of protection between patients and our staff during certain procedures. So much interesting innovation going on, and more that we'll be sharing over the coming weeks. We've received interest from more than 160 active or retired physicians, advanced practice clinician and nurses to serve our community, and we're continuing to take those names. So our coronavirus hotline that Dr. McGann mentioned has been a great option for folks to reach out to us. We are now getting over 500 calls a day on that hotline. And that is from patients, from community members, from businesses wanting to connect with us. Within the community, there's some basic steps we can all take to slow the spread of COVID-19. And I know sometimes we repeat this a lot, but it is just so critical during these times that we don't let our guards down. Many of you have already made drastic changes to your daily operations and personal lifestyles, and we're so thankful for that to slow the spread. Please continue to follow those CDC and PA Department of Health guidelines for social distancing, employee safety, and wearing a cloth face covering in public. One area that's really important is having a plan in place for how you will self-quarantine if you get sick or come in contact with somebody who is confirmed positive. You can visit the What to Do If You Get COVID-19 section of our webpage, wellspan.org, and then clearly on the front page, you'll see where to click for information on how to self-isolate from others and when it is appropriate to stop self-isolation. There are a lot of questions in our community right now on this topic, so please read that and pass that along. It's important to self-isolate yourself from others, even those living in your home, as much as possible, even if you have mild symptoms. Amidst the changes to our everyday life, it's really important to maintain, as Dr. McGann said, good mental health. It's not uncommon to feel stressed or anxious. Also on the website, we have an entire section we've added on maintaining good mental health. This has been developed by WellSpan Fieldhaven, one of the leaders across the nation in mental health services and programs. Here we have coping strategies and information on how to access virtual support. You can also find a 5-part video series with coping strategies for self-care, and I found this personally particularly helpful. For those needing additional support, an option to quickly access telephone support through our COVID information hotline is also available. I know I've had a question from many people about whether they can use and distribute the resources we have on our website. The answer to that is yes. We've produced these so that you could provide links to your constituents and your folks who you reach out to. Our WellSpan team is fortunate to have strong support from community-based organizations as well. Working in each of the local communities that we work, our social service providers and community government officials, transport, food, have come together to really develop great protocols and outreach for care for individuals in vulnerable population groups. Sharing resources and supplies as much as possible and connecting with each other. So just thankful for that. We also, for community organizations that are already not connected to this work, or you have a question, you can call that toll-free hotline and just hit option 3. It goes right to our community health team and we can connect you with those issues. On the website, there's also I Want to Help, an I Want to Help section, and a couple of points that I just wanted to focus on. First, with the use of masking that is occurring in our community, you heard that Dr. McGann mentioned that we announced we've joined the 100 Mask Challenge. This was initiated by the American Hospital Association to meet the growing demand for masks. It's a nationwide effort calling on both manufacturers and business community and individuals to contribute to this effort. And I'll tell you that for those who are sewers, we have a pattern out on the website. And since we issued this challenge and joined this challenge on Monday of this week, we have already gotten donations of about 15,000 masks that are being distributed. And those are just the masks for the community. I would also want to highlight that we want to remind the public of our need for blood donations. Because blood drives are canceled due to social distancing, we're finding we need to make concerted efforts to still encourage healthy blood donors to donate at our donor centers. There's information out there on that. And lastly, we encourage a simple way. Everybody is looking for their way to help. You can always do that through a monetary donation. Your donation supports our local WellSpan hospital foundations and Phil Haven, our behavioral health services. If you do one thing today out of all of this, I would ask you to just continue to share those public service messages, helping us to slow the spread, to take precautions, and you can continue to find that on our community partner site. I'd like to end my comments just by saying thank you. The outpouring of support and partnership is something that we don't take for granted, and we don't take for granted all of the trust you've put in us. So you have helped us really immensely on so many fronts, and our teams really do feel supported by that support. And know that, I hope a takeaway message for you is that we are here to help you as you respond as well.